Hi, I'm Dr. Jonathan Pinto with Noble Choice Chiropractic, and we're going to go over how chiropractic helps with acid reflux in our office today. You see, typically you think, how would I have burning in my chest, a fullness in my stomach, and then go see a chiropractor to get help with that? Chiropractic's just neck pain and back pain, correct? Well, in our office, what we see with acid reflux are tremendous results. Many patients are getting better, and how that happens is that when we adjust through your thoracic spine, this middle portion of the spine here, it helps to give normal movement to the rib cage. So first, just everything moves properly. You have that movement. There's no extra pressure in through the stomach, in through the organs, in through here, which can cause some of that acid to come back up into the esophagus, which is what gives you that burning feeling. But then more importantly, when we go through an exam and we take an x-ray to confirm, if we find any subluxations, so that's a joint that's not moving how it's supposed to in through this thoracic spine, if there's a subluxation and it's putting irritation on the nerves in through this thoracic spine, we know that these nerves in through this middle portion, they're going directly out into your stomach. They're dealing with innervation to the stomach and how the sphincters close to prevent that acid from coming back up out of the stomach, which causes that burning in through there. So we always start with the exam. We make sure that there is a subluxation, then we confirm it with an x-ray, and if those line up, then we know we can help. Because what we're gonna do is we're gonna have you laying on your stomach, we're gonna put our hand on the spine exactly where that joint isn't moving properly, and there's irritation on the nerve that's exiting through that joint. We're going to apply a nice easy pressure to adjust that joint, return normal movement, so that nerve that's exiting, it's just gliding through there freely. There's no irritation on the nerve, which then means that the signal down the line from the mid-back out to the stomach, it's all working how it's supposed to, your body functions how it should, and that acid doesn't come back up out of the stomach into the esophagus, causing that burning. So if you have any questions, feel free to reach out to us. We'd love to help with you. We see tremendous results with most of our patients with this in the office. We'd love to help you too.